Hello, welcome to Team C's presentation of learning disabilities. Okay, so first we're going to start with some DSM-5 specific characteristics of the learning disorders. First is on achievement scores using standardized measures. We typically see a score less than 78 on reading, writing, or math, and this can indicate that there's a learning disorder present. In addition, often compared to other children in the general population, we just see the score is lower than them in comparison. So although this can indicate a disorder, it's not necessarily enough to diagnose a learning disorder on its own. Okay. So here are some more criteria. There could be academic problems from an early age in school, children in middle school or below. And this learning disorder can obviously negatively impact performance in school and also in just daily life. And specific to academic performance, their ability is usually worse than others, but it doesn't necessarily mean that they have a lower cognitive ability. So that's something to take note of. And often with learning disorders, we can see anxiety and medical problems and vision and hearing problems as well. Okay. Here's some more criteria. I'm just going to read through these. We have some inaccurate or slow, effortful word reading, difficulties in understanding the meaning of what is read. So this is to do with, obviously reading comprehension. And then there's difficulties with spelling, difficulties with written expression, difficulties mastering numbers. This is more in the math section. Difficulties with, other mathematical reasoning. So now we're going to look at the prevalence rate of LD in children and adolescents. Younger children, we're seeing about 5 to 7.5% population having LD, and then then we're going to talk a little bit about adolescents, because in order to do therapy for older children and adolescents, there's typically 3 steps that we go through. There's the identification and modification and generalization. And then, so if we look at the number of children and adolescents combined, we're seeing at a recent census that there's about 6.7 million that are diagnosed. So yeah, it's pretty prevalent. Okay. So lastly, I think we're going to look at some gender ratios. So what we're seeing is that males tend to be diagnosed at a higher rate, around 9%. And we're seeing females, lower at 5.9%. This could be due to a number of factors. There could be some confounding variables that we're not aware of. For instance, males possibly just have more behavioral issues in general, which can sometimes make it more likely that they'll be diagnosed with learning disability. So this is just the slide, basically reiterating what I just said. Difference may be caused, behavioral issues among boys. Boys are often more disruptive. So I'm gonna kick it over to Jake now.
So now we're doing reading LD. The prevalence rate, about 5% of children overall have any type of SLD. Reading is the most common. About 80% of children diagnosed end up having a reading LD as well. The onset and duration. So the most typical time a reading LD is found is in childhood. It can be found later, but most of the time, because of schooling, it is found in childhood. It's a lifelong condition, at least some are, like dyslexia. However, with intervention and therapies, it is possible to improve reading comprehension and just reading skills as a whole. Primary symptoms. So poor phoneme awareness, difficulty sounding out words, the processing speed of what's being read, so it takes you longer to comprehend what's being told to you or what you're reading in front of you. Reading accuracy, rate of fluent reading, so you can't read as quickly as what would be like the standard, and reading comprehension, so you don't really understand what is being read to you. Secondary characteristics would be academic deficits in all areas of schooling. If you are poor in reading, I mean, you have to read for all types of problems. I mean, science, math, so it just academically you can perform worse in all areas. Poor response to visual or written instruction. Obviously, if you have really bad reading LD or like something like dyslexia, it might be hard to actually completely understand the questions being asked. And difficulties in written expression as well. Interventions and treatment. So you can use systematic instruction in phoneme awareness and phonics to treat problems with reading words. Guided oral reading. This can be done by a teacher or a parent. So it can also be done digitally, like a computer, nowadays with technology. It can help parents also play a part in child improvement, not just like at school where they're learning. Teachers and parents, they can use they can emphasize core words to help form base vocabulary. This can help with phoneme awareness. And dyslexia, that's the big one. Dyslexia can have symptoms such as the inability to spell words, read words, difficulty sounding out words. Thought to be caused by genetic and environmental factors, so it's not just like you're born with it. Like environmental factors can bring out dyslexia. Children with dyslexia are also at a risk for ADHD, at an increased risk for and dyslexia is lifelong. It's generally found during childhood, but like I stated earlier, if you have interventions or treatments, you can help reduce how powerful it actually is, or prevalent, I should say. That's not me.
I'm talking about writing learning disorders. Some primary core symptoms would be IQ achievement discrepancies, problems with oral expression, problems with written expression, problems with listening comprehension, some intra-individual discrepancies, responsiveness to intervention, and jumbled up spelling. Some secondary symptoms would be lower academic performance, struggles with performing tasks that require academic skill, repeating grades in school, they drop out before graduation, they have sloppy handwriting, and they also have low social self-efficiency. Some psychological treatments would be self-regulated strategy development. Self-regulated strategy development teaches children how to plan and review their writing. They're taught to think about goals for their writing, to generate organized ideas, and to elaborate on the sentences that they produce. Self-regulated strategy development is associated with improvements in writing skills with kids with learning disability and developing kids in general. Some important facts is learning disorders is lifelong, learning disorders have increased over the last 30 years, and children that have low socioeconomic status are at an increased risk of learning disabilities. Boys are also diagnosed more than girls. And that's it for me.
I'm going to be talking about math learning disorders and dyscalculia. 3 to 6% of adolescents and children have a learning disorder. 11% of those children are diagnosed with ADHD as well. Children biologically are predisposed to understand and process mathematics information. Starting at infancy, children have number sense, or they may be aware that groups of stimuli can be understood in terms of their quantity. Deficits in number sense that persist into first grade predict math disability. When in first grade, it is okay to digit count, so using your fingers to count, but if that persists past fourth grade, they are normally diagnosed with a math disability. There are several different types of counting and calculation errors. There's one-to-one correspondence, which is one number is assigned to each object. There's stable order. Numbers are counted in a specific order, cardinally. Last numbers stated reflect quantity of items counted. There's abstraction. Objects of any kind can be grouped and counted in order. Irrelevance. Objects can be counted in any order. Children who have math disabilities normally have issues with one-to-one correspondence, stable order, cardinality, abstraction, order, irrelevance. As stated before, learning disorders are lifelong, as well as any type of, reading, writing, math disorder. As I said, typically shows itself before fourth grade. A lot to do with digit counting. There are some primary core and secondary symptoms. As you can see, problems organizing or difficulty with language and math, a lot would have to do with children who are learning to do math word problems. They have issues with remembering the time, the date, and ordering those. They have extreme difficulty with money and making change. And I'm going to talk about treatment and help. There is direct instruction, which in mathematics, like direct instruction for other skills, involves the systematic presentation of math calculation and problem-solving strategies. The teacher may introduce and demonstrate the skill following a carefully designed script. Then the skill is broken down into specific steps to allow the student to understand better, so it breaks it down. Self-instruction, teachers systematically present a series of nonverbal prompts that children can use to solve math problems. Teachers model the use of these prompts as they complete problems. Then children are encouraged to use the prompts, then solving their own problems. And the last one is mediated or assisted instruction. It begins with the child's understanding of mathematical problems. They then offer assistance and guidance to help the child solve the problem correctly. Mediated or assisted instruction does not involve the use of a script or a series of prompts. Instead, the teacher offers increasingly detailed hints until the child is able to complete the problem successfully. Direct and self-instruction are most effective with younger children, whereas mediated or assisted instruction is recommended for older children. And there are many ways to improve. There's things such as playing dominoes, and instead of strictly sticking to worksheets, create fun ways to try and help your child understand math problems. Also try to help their memorization skills by making them do multiplication tables, and just try and find different tricks and ways to help them understand math better.